Hello, my name is Cheryl Garcia and I work at Tucson Orthopedic Institute Physical Therapy Department, and today we are going to talk about proper sitting and standing posture along with a proper technique to get in and out of bed. This would apply to anybody who has chronic low back pain, who has a recent injury, who is post-surgical, or for anybody in general. This will help to keep your spine aligned so that you do not injure or cause any further deterioration. So we're going to start with sitting and standing. This is Julie, so she is first going to demonstrate improper sitting and standing, and then we will look at proper sitting and standing. So Julie, if you will stand up, please. And as you can see, when she stood up, she really rounded into her spine. And now sit down, Julie. And again, she rounds into her spine, creating a lot more stress into her back, using her back to lift and lower her versus her big leg muscles. So what we want her to now do is to protect her back. She's going to brace and tighten in through her belly. She's going to lift into her chest, and she will hinge at her hips. She'll still have to lean her trunk forward, hinging at her hips, but now she'll be using mostly the muscles in her legs. And now you can stand up. And that protects her back. She's not pulling and straining into her back. So when she sits down, she's also going to tighten into her belly, lift into her chest, and she's going to keep everything tight in her belly as she hinges at her hips and lower herself down using her leg muscles. So Julie, demonstrate. Okay. So that will eliminate a lot of stress and strain into your back every time you get up and down from a chair. This will cause you to use your muscles into your low back, using your big leg muscles to lift and lower you versus straining and pulling into your low back. Okay, so now we're going to talk about getting into the bed. So in order to get into the bed properly, again, you still want to brace and tighten in through your belly, but first we're going to demonstrate getting into the bed improperly. So Julie, if you will just demonstrate that. If you will lay down into the bed. And again, she just kind of plops, her knees come apart, she's not bracing with her belly, her spine is much more vulnerable, it's not protected and aligned. And getting up, same thing, if she'll demonstrate incorrect technique. And again, her legs came apart, she pulled and strained into her back to do this. Now in order for her to get into bed correctly, she's going to, again, brace and tighten with her belly. She's going to keep her spine completely straight. So she's going to lay down onto her side. Her knees are going to stay together. She pulls them up. Her spine is still straight and protected. Now she's going to roll as one unit onto her back, keeping her knees together. Okay, and now she's going to get up. So she's going to again roll as one unit over to her side. Her knees again stay together, protecting her low back or SI region. She's dropping her legs off and pushing up with her hands. Again, her spine is straight and supported. So this significantly reduces the amount of stress into the lower part of her back. And this is the proper way for anybody to get in and out of bed to reduce the stress and strain on their back. So whether you are post-surgical, or you have chronic low back pain, or you've just had a recent flare-up or an injury, this is the proper form to get up and down from a chair or to get in and out of bed. So this has been Back Safety with Tucson Orthopedic Institute. If you have any further questions, you may go to our website, tucsonortho.com.